behind this dismal picture?
Well, this number is a very, very shocking statistic, and a shameful number for any country to have. The largest number of children dying on the first day is in India, which is about 300,000 children. The reasons are plenty, and the important thing is to focus on where the issues are. I mean, we know that where the issues are, it will be
really because the access to healthcare facilities at the primary level is also very low. Would you agree with this, and why do you think we have this kind of a situation?
The causes for the very high infant mortality, which is mostly pegged because of the deaths in the first month of life, neonatal mortality,
yes,
are arising because of causes within the health system. So the whole social determinant complex must also be looked at from the point of view of contributory causes. But within the health system, the neglect of primary health care, despite the good intention that we have had since independence of providing good rural primary health care, has led to inadequate care right at the point of antenatal care to the point of delivery and the postnatal care. And one of the glaring examples is the low health workforce, low in numbers and poor in training. While the National Rural Health Mission has tried to address some of these, inadequate, and they have not been supported with adequate infrastructure. So even if a pregnant mother does overcome all the difficulties and reaches a primary health center, she is not assured of safe delivery in the hands of a skilled birth attendant. And that's one of the major problems we must overcome. So we need a thrust for improving our primary health care by strengthening multiple levels and components.
Mr. Chandy, cultural practices, early marriages and childbearing, low birth weight, stunting, there are different factors that have been blamed for this. But ma'am, what would you like to say about these factors, the prevalence of diseases like anemia among young women? They are not even aware about it, and a practice which we have not been able to contain, that is early marriage. You know, that's something which really is probably the start of this problem. What would
3 lakh babies dying in India on the first day. I mean, it's mind-boggling. We've been working on the issue of malnutrition, where you try and reverse the trend in the first 1,000 days. 1,000 days will follow. This is the first day we are talking about, where a child who should have the right to life and a dignified life, productive life, will not have it. I mean, what their children and women get short shrift of everything. But coming to your question, and underweight babies get born to underweight mothers. And underweight mothers, why? You have early marriage, you have early pregnancies. In pregnancy, the woman will not be looked after. She will get the bacha kucha khana. It's the way the woman is viewed in the family. Then you come on to the institutional delivery. Of course, the whole issue of access to information, education. The whole thing is inextricably tied to the status of women in our society. And I say that this issue of the first day deaths or of malnutrition, which affects just around half the children under 5 in India, is the biggest gender issue today, which has to be addressed not just by health practitioners, it has to be addressed by women activists, it really has to be addressed on an emergency footing.
But then there are different figures between countries and within countries. Well, it's about India. We have different figures coming from different states. Some states have not been really performing very well. And the 3 major, there had been a lot of work that has been undertaken by the state governments, the respective state governments.
First of all, I'd like to say that there are a group of MPs, including myself, who have been working with UNICEF and other stakeholders in trying to create a non-partisan base inside Parliament who would work on this issue without politicizing it. But since you mentioned Odisha, I must also point out that Odisha has traditionally been extremely poor, but in recent years it has seen quite dramatic improvement. But even despite that improvement, we still have these concerns of first day deaths. There are 3 or 4 things I'd like to say about it. These are shocking numbers, of course. But what is much more shocking, the womb, because the mothers themselves are in such measure undernourished.
Underfed.
So children start out, with problems of stunting, with problems of lower development, both physically and mentally, and it has lots of challenges throughout the lifespan. So in a country where we have a demographic nightmare, unless we can tackle this issue. So the reasons are complex, but since you mentioned that certain states are more affected, it is of course related to multilateral agencies, that there is something other than just poverty which is also affecting the mix. These are social issues like girls having, something like 80% of teenage girls in India have anemia because of these social practices. Girls are fed last in the home, things like that, and almost half of the women getting married in India are not really women. They're girls. Some of them are just barely 18. So these are all problems that need to be tackled on a war footing. And since I'm part of a group which is trying to work on a non-partisan basis, I don't want to politicize the issue. We can always argue that, I've done better, you've done worse, central versus state. All these things I don't want to bring into this. What we need to do is actually work on a war footing. The one thing I would like to say is that it's not that malnutrition is getting worse. It's not. It is actually getting better, but very, very, very slowly. And it's not keeping pace with the growth of the economy, with the improving standards of living in other measures. So what we need to really do is target the worst hits parts of the country. There has been in fact discussion within the Planning Commission, within the central government, in our discussions with leaders of the opposition and government and state and national levels, that we need to target the 200 worst affected districts. Because about 8 states or so and about 200 worst affected districts in India contain more of this problem than all of sub-Saharan Africa. But let's not really focus on the 200 worst districts if we are to make a dramatic improvement in the near future.
Okay, we are joined by the Deputy Commissioner with the Deputy Commissioner Child Health from the Ministry of Health and Family Welfare, Mr. P.K. Prabhakar, on phone line with us. Mr. Prabhakar, welcome to the program. I suppose you were listening to the part of the part that we have discussed so far in this program. Mr. Prabhakar, what would you like to say about the points that Mr. Panda just made, that we should focus on the worst affected areas first and probably then we can introduce some changes, and your initial response on the findings of the report released by Save the Children?
Yeah, thank you. We about the 2.5 lakh deaths we are estimated, and we are aware of this, and many of the programs that we are taken up in the last few years, especially under the National Rural Health Mission, address this issue head on.
What are the reasons that your ministry has identified, sir, behind these appalling figures?
This figures, actually, one of the reasons is that we have to have safe delivery at birth. This is very important because the newborn death and health is not just depending upon the birth, but also on the health of the mother and how young she is, whether she is having multiple pregnancy, whether she has any complications or difficulty during the pregnancy, what care she has to received in the antenatal period, and how much care she has been taken during the pregnancy, any complication that occur in pregnancy. All these factors will definitely have a role in the outcome. And as I said, the outcome depends not only on the mother, but also the health of the mother. If the mother is young, she is adolescent, or she is a late adolescent, she has early marriage, she has too many children, then it is a multiple pregnancy, then naturally there are chances of she having complication and also the baby having problem, baby being premature, baby being low birth. These also increased proportionately or disproportionately, leading to neonatal health problems as well as neonatal mortality.
Okay, Mr. Prabhakar, I would request you to kindly stay online. We'll slip into a very short break, and maybe in the other segments also we'll get back to you on the initiatives that have been taken by the ministry as well as the status of the implementation. We'll take a very short break in Public Forum. Please stay tuned for more. Welcome back to Public Forum. In Public Forum today we are talking about newborn deaths. Years, at least in India, we have seen that there had been some achievement in bringing down deaths per 1,000 live births, that is infant mortality, but deaths within 28 days of birth, that is neonatal, and under 5 mortality are the areas where certainly efforts have to be made. In fact, the Minister of Health and Family Welfare also accepted it during one of the meetings in this year, in the beginning of this year. What would it?
And 300,000, and there are 26 million children who are born every year. But however, you should look at the proportion, you should look at the denominator. And if you look at countries like sub-Saharan Africa, their burden is about 12 per 1,000 on the first day. 12 children die on the first day. And when you look at India, it is 11. So to say that we are better off than Sub-Saharan Africa, I don't think we should really be gloating.
Sir, Dr. Reddy, I would like to start with you, sir. Since there have been reports and there have been clear statistics that institutional deliveries in these particular states that I mentioned, they have not been, the figure is not very discouraging. We have 63% of institutional deliveries recorded in Madhya Pradesh. In Uttar Pradesh, of course, it's less than 50%. In Odisha, it's near 50% again. Still, maybe it's not just these facilities that are really able to help these states to come over the huge figures which they've really lacked.
Absolutely. The problem here is that if you look at the interstate disparities, a girl baby born in Madhya Pradesh is 6 times more likely to die in the first year of first year of life than a girl baby born in Kerala. Infant mortality rate in Kerala is 12 per 1,000, which is almost as good as Sri Lanka. So if it can be done in one state to 1,000 population, is very low. I mean, in the sense there's a huge disparity between other states and states like Madhya Pradesh. And unless you have adequately trained nurses, community health workers and doctors available in the facilities that have been set up, you are not going to get the kind of care required. And if you are very short of doctors, then you ought to use non-physician healthcare providers. Abhay Bang, for example, has shown in Gadchiroli, in a very poor area of Maharashtra, that by training community health workers, you can reduce to the sub-center level to the rest of the primary healthcare system. Unless that is done, we are not going to see much of a change. Plus, of course, if you are going to have anemic adolescents, gender discrimination at birth, early marriage, all of these are going to be also factors that are going to influence. And Madhya Pradesh, in some of those social indicators, is far behind some of the other states. They have to catch up. So you need action, as has been repeatedly pointed out, both within the health system as well as outside the health system. Let me just make one more point. It is very important in a mission mode to focus on the first 1,000 days of life, but it is incomplete. Because if you are going to have an unwanted girl child, an underfed girl child, an anemic adolescent, going into an early marriage, living in a rural poverty, then even focusing on the first 1,000 days of life is not going to make difference just by focusing on pregnancy. You need to have action at different levels at every stage of life. But certainly in a mission mode, focus on the first 1,000 days, because what is measured is done, so have some indicators there. But unless there is a total change in the social environment, you are not going to see this improving dramatically.
Okay. Mr. Panda, here, especially about Orissa, I learned that the malnutrition rates have really come down, and much of it could be really attributed to the Anganwadi centers and to the self-help groups. Do you think that these are the branches which would have, really worked well, probably in certain other areas too, where we want to really reach to the